This is Scott Jentz. Welcome to Sandbox Stories. Hello, welcome to this Sandbox Story, which is an interview with Dr. Araba Otoo. Dr. Otoo is a 2022 graduate of the Ohio State University College of Optometry and comes into the profession with a master's in public health, which gives her a very unique perspective. Dr. Otoo, welcome to Sandbox Stories.
Thank you for having me.
It's my pleasure. I'm really excited to share so many interesting stories. I think I've got a good place to start. You grew up as a child in Ghana, West Africa, with a mom who was a teacher, a dad who was a mechanical engineer. I'm curious what family values from your childhood you used to guide you today.
Oh, the family values. Well, respect for people, right? That you should respect people regardless of their background, and you should, value them as a person. I was brought up in a Christian home, so being a Christian, loving people, whether their values coincide with mine or not, that's not the priority. The priority there is to just love on them. So that was very paramount in my upbringing and just respecting people for the most part.
Tell me more about your family and what it was like growing up there. What was your household like? Did you have any grandparents you were close to?
So my grandparents lived in the village. So we lived more in the city and my grandparents were away and we only saw them a few times. So I did not meet both grandfathers. I met both grandmothers. I did not spend a ton of that time with them, but every so often they would come to where we lived in the city. And then, they'll teach me how to cook and things of that nature. So it's a little bit different. I didn't spend a lot of time with them, but I also lost them pretty early growing up. So I didn't meet both grandfathers, but I met both grandmothers. Yeah.
You told me you have a love of cooking. Is that where it started?
Yes. So as a child, so I had two brothers, and growing up, that was a little bit of a struggle because I did not have a playmate. Right, the boys played together, and who was I going to play with? Right, and they were not interested in the things that I was interested in. And if I tried to play soccer with them, I kind of messed it up for them. It took the fun away from me because you have to use your foot
because you were better than them.
I wish. But, back home we called it football, right? So instead of using your foot to play the ball, I would be grabbing the ball. So hence, I did not make the game fun for them. So anyway, I did like playing house a lot, right? So I would grab things from the kitchen. Grab without permission. And then we had a backyard that had garden, like a garden that we had, foodstuffs growing up there. So I would go to the garden and just harvest things without permission, of course, and do my thing in the backyard. And, so that's how I started as a kid. I didn't think anything of it. It was just part of being a girl child growing up in Ghana. I didn't have much toys to play with. So that's what I did. Yeah.
That sounds like a great way to have gotten started. You have some really interesting family stories about eyes from your childhood. I want to start with the story about you being a malingerer so you could get glasses.
Yes.
I got to tell you, I've had a lot of optometrists on Sandbox Stories. You're the first one that told me that you are a malingerer. Tell me what you did. Tell me what that was about.
Right. So I remember multiple times I would go to the eye doctor because I was telling my mom that I'm having trouble seeing. And I would go to the doctor and I would clearly see the letters, but would say something completely different from what I was seeing. And I think the doctors were just taking advantage of this girl who did not know any better to make money off my parents. Does that mean, like my mom, right? Because my mom believed in her eyes are not working well. We need to get her glasses so she can see, right? So I got prescribed glasses. And when I got prescribed glasses, I mean, at that point, I didn't know what was a strong power or a weak power. I just know I had glasses. And when I got glasses, I hated it. I disliked it because anytime I wore it, I had headaches, right? But then again, my mom, my dad all believe in, you have to wear these glasses so your eyes will correct, right? So when I'm at home, I cannot study without wearing the glasses. So I had to be really wear the glasses around my parents. But then when I went to school, the glasses would be somewhere and I would be somewhere. So I always got the strings with the glasses. Somehow that was fashionable growing up. So I would have the string and leave the glasses hanging over. And I would go about my day. And so sometimes I would have a lens fall out. It would break. I was just really careless with it, in part because I didn't care for it. And my mom would replace it every time I broke it. And so, yes, I feel
So,
for a very long time. And then I went to high school. So high school was a boarding school. So I went away from home for the very first time. And then at that point, I got an eye infection, hemorrhagic conjunctivitis. So this is actually seasonal. Every year we get it. And we call it Apollo. So I forget exactly why we had that name correlation, but it's called Apollo season and everybody gets it. And people usually try not to contract this infection or, get conjunctivitis, but I welcomed it. Someone has to, that person is going to be sitting by me that day. I'm going to sit by them that day. And then I would get conjunctivitis. And I also fancied, because we used antibiotics, like the ointment antibiotics. That was the mode of treatment. And I think that's because maybe of the shelf life. It's the shelf life is longer, right? So I fancied putting ointment in my eyes. And so getting conjunctivitis and getting to do that was gold. At the time, not now.
it's fascinating, right? I mean, it is how some children behave. And I think we're going to talk a little bit in a second about how there was this real genuine interest in eye care. Before I go there, though, somewhere through your training at Ohio State, or you met that first child who malingered, right? That started. You picked up on, they were calling every letter L a C or every M a W. Do you remember a time like that?
Well, in Ohio State, the kids that I had were not old enough to do that.
Okay.
So I didn't get a malingerer, right? But, we were always taught the suppression ways to catch them. And so I feel in this, the training that I got, even if I find a malingerer, it's not going to be scolding the child, right? It's more talking to the parents. It's your child really wants glasses. Let's get him or her glasses without any power in it. And that would just solve that issue. You know what I mean? But back in the day, again, I'm not sure what glasses they gave me, but I felt like it was a real prescription. Hence, I got headaches. You know what I mean? Where they could have just bought me fake glasses and everything would have been great, Yeah.
I don't know about my audience members, but I'm thinking they gave you a low minus prescription and you were told to wear it for near and whatever. So now the family stories continue because your dad had surgery for a pterygium and your mom unintentionally put typewriter whiteout in her eye. And then you saw care being delivered to them. You talked about going to a teaching hospital. That started to motivate you toward eye care. You wanted to put ointment in your own eyes, but you saw this. Tell us a little bit about how you saw that care being rendered to your family.
Right. So my dad, back in Ghana, the word operation is just scary. And I didn't know what operation he was going to have until the day after. And, I think at the time my dad's pterygium was recurrent, or maybe it was just both eyes. So he did one before the other. I just know that it was at least twice. Right. So dad had gone in to do surgery and suddenly he comes home with a huge patch. It was just very serious surgery, right? I think he was admitted at the hospital. I mean, you don't do that now. You just do surgery and you go home, right? But it was a big deal back then. So anyway, I just recall going to the hospital with my mom a day after. And then I saw a lady, tiniest lady I have ever seen. That's how I remember it, right? Wearing a black navy blue skirt suit, walking towards her car. And then one of the nurses pointed to her and told me that was the lady who did your dad's surgery, right? And I feel like at that point, it had occurred to me like, oh, wow, a lady surgeon in a society like this, that was just like, wow, and amazing to me. And I feel like that got it started, that I am going to be a doctor. Do you get what I mean? And so that was how my dad's thing started, with the surgery, with the pterygium and everything. At that time, I didn't really know what pterygium was. I just knew it was eye surgery. And then my mom, she always wore glasses. She always had a number of things with her eyes, and she was a teacher. So, her bag is usually full of supplies. And supplies included having this big whiteout solution. So she had compartments for everything. So she had a compartment for her eye drops, and next to this compartment was a compartment for this big whiteout. So one time we're just at home, and then we get a call that mom had to go to the doctor because she accidentally poured Tipex, which is whiteout, in her eyes. So, that thing dries out really, really fast, right? So she went to the doctor, and of course they did what they had to do, scrape it off, and then come home. So I feel like these little stories all contributed to, like, every so often there's an eye issue, right? Every so often there's an eye issue. And then I went off to high school. So growing up, because of the company that my dad worked for, I had good health care, like comparatively to what people had, right? So I did not really experience the realities of healthcare in Ghana until I went up to high school. And when I went up to high school, across my school was one of the largest teaching hospitals in Ghana. Again, this is like the largest teaching hospital in Ghana. I expect top-notch, care. But again, it's public, so maybe I should lower my expectations. So anyway, I got conjunctivitis, and then I asked for time off to go to the hospital to get my eyes checked. I believe I had to go about 3 times before I was able to get anybody to take a look at my eye, because, they only gave me so many hours to go out of school, and then I would go, and there was a long line. And frankly, a lot of people had more serious needs than I did. You know what I mean? And I just recall that at the time, doctors were on strike. Nurses or doctors, one of the healthcare professions, were on strike, right? And so it was chaotic in the hospital. And so when people came to the hospital, you have to go really early to be the first person in line. And even so, you being seen by a provider is not guaranteed, right? So I remember my school was right across the school. I did not have to drive or travel. It was right there, but I always found myself in a very long line. And this was, sitting in the waiting room, waiting to be taken care of, was when I saw, because I'm sitting there and I'm just watching what's going on. And a few nurses walking by. The waiting room is full of people, some people in wheelchairs, in cloth. Just, I don't know how to paint that picture, but it wasn't a pretty picture to see, right? Mm-hmm. I recall seeing a lady live having a stroke, and people were just passing by here, and I'm like, this is awful. You know what I mean? But anyway, that was when I feel like I saw the realities of healthcare where I had lived for a very long time, So that planted in me the desire to be a doctor. I mean, when I started high school, all my classes were science, because back home, you start towards your career in high school. It's not college that you start. So I was enrolled in science classes, but I feel like having gone to that hospital and experienced that, like seeing it with my own eyes, made it real for me. You know what I mean? And also where my school was, every weekend we would hear dirges, like, funeral songs, like people parade around and singing dirges. And it's like every blessed weekend someone passed. You know what I mean? So again, it was uncomfortable going away from home, but at the same time, I grew up there. I got to know more about where I live, because you could say that I was shielded growing up at home. You know what I mean? And so I think that did something for me. Every stage of life, it feels like it does a little bit for you and pushes you further to the direction that you're supposed to go.
Well, so then your family decides to pack up and move to the United States. And talk about a change. And you moved to the Chicago area, and you told me that you worked at Target.
Yes.
But you also got involved
Yes.
in a cancer research program at the University of Illinois, Chicago.
Yes.
And you were telling me that you were thinking of careers in eye care and cancer care. You've already told us about your motivation to be a doctor. Tell us a little bit about this experience you had in this research program and how the cancer research really positively changed your life again.
Of course. So I, went to community college when I first came in. My brothers and I understood that Dad brought you to America. He will provide a place for you to stay, food to eat. The rest is up to you. So we all just worked and put ourselves through school. So I went to community college and then transferred to the four-year university, which is University of Illinois at Chicago. So one summer, a friend of mine told me about a summer research opportunities program, SROP for short. And so I decided to apply. And in my application, I had to express my interest. So my first interest was eye care, and my second one was cancer care. I don't remember my third one. Basically, for that program, I had to find a mentor for myself, struggled to find a mentor for that program, but the program matched me with a mentor. And this match was Dr. Jasmine, who is an optometrist and also an epidemiologist. So she balances, these two fields in eye care and cancer care, specifically ovarian cancer, and, doing all public health and optometry and cancer care all together, that good mix. And that's a great mix because you have that variety, right? There is enough variety in eye care and there is enough variety in cancer care, and you put it together and you have variety, you don't get bored, right? So anyway, I got matched with her, summer started, and then I just got engrossed in public health, right? That was when I got, my crash course to public health. The hot topic at the time was all obesity and hypertension and diabetes, which are still hot topics now, but that's the bulk of things we were talking about, right? And so I got in there, I was like, yeah, I don't want to talk about all these other things. Can I still do my eye care and be public health? And of course they welcomed it. And my mentor was optometrist. So why not, right? So I got to work with her all throughout that summer. She actually had the data sets to the ERIT study. So she gave me the data sets and I had to learn how to use a statistical software called SAS to analyze the data set to find out if there is any inequalities in dietary intake and how that affected IOPs. So that was great. It was a hard summer. It was learning a whole level of statistics that was just beyond me. But I really enjoyed my time with Dr. Jasmine. She took time, very busy lady, but I really knocked on her door a number of times. And there were times she was like, I'm glad you knocked because if you don't ask, you will never get. And, there were times that I felt like I was annoying, but it is what got me where I am. And it is what got me the help that I needed from her, So anyway, summer passed. And then we stayed together, right? We stayed mentor and mentee. I applied for research opportunities at school. She maintained my as my mentor and still mentor-mentee relationship up until now. So summer ended. I think maybe a year later, I graduated, with my BS in chemistry from UIC. And so now, what are the next steps, right? So I really, at the time, wanted to do ophthalmology because I was like, okay, I want to do global health work. I want to do public health work, right? But optometry has a lot of limitations, especially where I come from. All the doctors that I have encountered with back home were ophthalmology. The scope of practice is different. And I also do not want the limitations like, oh, you can't do this. Oh, you can't do this. I want to be the one to say that I'm not comfortable doing this, so I will not do it. So with all this mindset, I really wholeheartedly wanted ophthalmology, right? And Dr. Jasmine paved the way for me, right? She knew ophthalmologists. She will connect them with me. I will go shadow them. She's a great mentor. So all that happened. I applied for medical schools in Illinois because again, I didn't want to go out of Illinois. So I applied to maybe 4 or 5 medical schools in Illinois land area, and then I applied to optometry school. And so, there was a whole lot of deliberation going on there, right? I did not get into any medical schools, got accepted into optometry school. And now I had to make a decision. Am I really ready to give up what I have worked so long for optometry, right? And at the time, I was like, okay, no, we are going to give it another shot, right? And I did not make this decision independently. I talked it over with people. I got advice and said, okay, you applied just once. Why are we giving up when you applied just once? You've done all these things. It is phenomenal. Don't just give up, right? So I elected to do my public health degree and then strengthen my application and then reapply. So I did not accept the offer to go to optometry school. So I did my public health degree. Again, I loved it. I still did eyecare when everybody was doing, cancer, obesity, blah, blah, blah. I'm like, it's still going to be eyecare. So that's what happened. And so during the time, I met a lady who was doing her PhD. It was public health, but she was also working under Dr. Jasmine. And then she had gone to Ghana to do Unite for Sight. So she told me about Unite for Sight and she raved about it beautifully. I was like, I'm doing Unite for Sight. Anyway, I got to do Unite for Sight and then I got to go to Ghana now as an outsider coming in. You know what I mean? So I got to Ghana to do 2 months with Unite for Sight and was able to implement an epidemiology study. It was for my capstone project for my MPH. So it was pretty cool, right? I was able to go home with a different outlook after so many years. And so when I went there, Unite for Sight in Ghana, I'm sure things have changed right now, but at the time they were working with 4 main ophthalmologists, and these ophthalmologists are spread out across the country. So because I was doing 8 weeks with them, I had enough time to spend with each ophthalmology. So that means that I was able to move across different communities and regions in the country that I did not even know about because I only lived in one tiny part, right? So again, that was very enlightening to me, right? Because I got to know my country a little bit more. And it's just sad that you grow up somewhere and you don't know anything and you had to come in differently to see that. But anyway, that was very great because I was able to do, again, eyecare, I was able to do public health. I was able to implement what I was learning in school. But at the same time, again, I was able to see the magnitude of the need in my home country, right? And it was saddening. And again, it further pushed me, this is what I want to do, kind of thing. So did Unite for Sight 2 months, and we would go do screenings in different communities. And, I always say that back home, we practiced public health without intending to. It's not like formal public health, right? Because how are you going to communicate to people who do not all speak English, right? Yes, right now I'm pretty sure a lot of people speak English because we are taught English in school, but there are some people who are not educated, and there are so many different languages and dialects, and I only speak one in 2 different forms. Do you get what I'm trying to say? So how do you communicate to a lot of people who don't speak the same language? And every region, yes, we are all in Ghana, but every culture or every tribe has a different culture. Like foods are different. So it is one country, but there's a lot of differences in a lot of languages, right? So again, growing up there or going back there, I see that we are doing public health. And one of the ways to do public health and educate people was acting and play. So let's say that you're trying to educate people about cholera and things of that nature. You would have plays and show people how this waterborne disease and things of that nature. So there was a lot of, again, public health that came to my realization later. And so it was pretty cool to see, we have malaria and mosquitoes, right? So you have like all these advertisements on TV with all these mosquito nets and showing how mosquito nets can kill mosquito. Again, that's public health. It's just on TV. You know what I'm trying to say? So it was cool to see that I have been in public health all this while, but again, I did not know it, right? So that was great. I came back, was able to finish my project with my MPH. It was very well received at the school. I was able to submit different abstracts for that, for the academy, for the APHA. It was just great. So then I came back and then I finished my MPH, and now it was time to reapply. It was time to figure out my next steps again, right? So this time I broadened my horizon a little bit, right? Went out of Illinois, maybe added, Indiana, neighboring states, because again, I didn't want to go too far from my family. And then I got a job at the UIC Cancer Center, again, So something that I did not say in my story with my match with Dr. Jasmine, which I feel like is a perfect match because her interest matches mine. And given how much work I had put in to find a mentor and did not find one, but they found me one that just, merged so perfectly that we have such a great relationship, and she has done so much for me where mentorship is concerned. You know what I mean? So anyway, I got a job at the cancer center. Now I was doing it was a clinical trials study office, right? So I was doing clinical trials and things of that nature. And now I was kind of like managing or looking at Dr. Jocelyn's studies as it came through the cancer center, right? So I was still in constant communication with Dr. Jocelyn. And at this point, I was getting replies from medical schools, and they were all like rejections. And I think I was becoming numb to it and kind of settling with the idea that I will not become an eye doctor. So Prevent Blindness, which is, an organization that exists in so many different states, Prevent Blindness headquarters in Chicago had sent out an email about looking for students who need projects for capstones, right? So I was like, well, I already graduated. I don't need a project, but I do want to be involved in eye care if I'm not going to go back to school and become an eye doctor. So I got involved with Prevent Blindness, did a lot of community health things where, in that area. So anyway, I was at work one day going through my emails, and then I got an email from Dr. Jocelyn. And she was like, I don't remember the exact words, but as I said, she summoned me to her office. And I get to her office and says, why is it 8 months or however months it was, and you're still at the cancer center? Like, what happened to becoming an eye doctor? What happened to going to school and becoming an eye doctor? Ever since I've known you, that's all you have wanted. Like, what is going on? And I was like, well, if I had, and I've changed a lot in recent times in terms of crying. I cry a lot. So I just started bawling, and I was like, if I had good news, you would be one of the first people I would tell. The fact that I haven't said anything means I don't have any good news. You know what I mean? And then she tells me to apply to Ohio State. And so I was like, why would I do that? There's a school in my backyard, and you're telling me to go across states, skip Indiana, and go to Ohio where I know nobody, right? So she did not get through to me, right? And I think at that time, again, I was kind of settling with the idea that I would not become an eye doctor. So I went into my office, did not give her any satisfying answers, and went about doing my duties. And then that evening, I got a message from her husband, Dr. Ulanski. So Dr. Ulanski is one of the ophthalmologists that I shadowed when I very started, right? And when I started, whenever they would have like ophthalmology residents come in, they have this 2 weeks of a crash course of ophthalmology. And I would be sitting in those classes, like, because I had Dr. Jocelyn, like, I got a lot of learning exposure with these people, right? So I really knew Dr. Ulanski. So I got a text message from him, and he was like, you need to come see me tomorrow. And I was like, I didn't ask him, why do I need to come see you tomorrow? I put 2 and 2 together, right? And so I think I had a doctor's appointment that day. So I was like, okay, I will come after this, right? And my job at the time was flexible, that, all I had to do was get my work done. Do you get what I mean? So if I needed 5 hours to get my work done, yes, I have 3 hours to do other things, right? So I had come back from my doctor's appointment, and then we had decided that we would meet at the Illinois Eye and Ear Infirmary. So Dr. Ulanski used to work for the Jesse Brown VA, which is right across from UIC. So every Friday he would come to UIC. He's retina. He would always be giving injections to AMD patients and things of that nature. So he took time off, and then we went to this huge conference room with this huge table. And then he sits at the head of the table. I sit by him, and he just bombards me with a lot of personal questions. And I was like, very, very uncomfortable, right? But I can't lie to this man. He's sitting right across from me, and he's not being nice about it. How old are you? When are you getting married? When are you having kids? I'm like, I don't know. I don't have answers. I don't know how it fits in the life that I want. I just know that this is all I want, right? So again, I didn't give him any satisfying answers. And then he tells me to apply to optometry school. And so at this point, I was like, fine, I will apply. I didn't have that attitude, but in my head, that's what it was, right? I will apply to Ohio State Optometry School. And if I get accepted, I'm not going. So that's what I said. And he was like, we don't care. All we want is for you to apply. So this was like February. It was a leap year. It was like end of February, beginning of March. And this is when applications are due, right? So I went home, quickly changed all my, essays to fit optometry, right? And it wasn't hard to do. It fit optometry. I just had to change the name, right? So I submitted my application. Lo and behold, I got an invitation to go for an interview. A friend of mine was really nice to drive me all the way to Ohio, had that interview, a very emotional interview, I might say. But it was great. I was honest in my interview, very transparent, asked me, why are you here? And just, again, I bawled, I cried, and I just laid it all down to them, right? But it was a very good, honest interview. I did not lie to them. It was great. It was just great. So I got out and then drove back to Illinois. And then a few days later, maybe in the next week, I got an email saying that, no, I think it was a call saying that you got accepted. And it was really hard because, a lot of people wait on these calls and that's just like screaming on the other end of the line, like, oh my God, I got accepted, right? But I could not rejoice that way because I had a plan to not go, right? And the reason why I had a plan to not go was to figure out, is this really what I want to do? And if this is really what I want to do, and also at the time I was a little bit bitter because years prior I had been accepted to optometry school and I did not take it, only to come years later to go to the same profession that I would almost have been done. So that was very, I had to settle with that, right? So it's a lot of me wanting to do things my way. And then Ohio State, so I was a chemistry major, so I did not take a lot of biology. And Ohio State had like requirements for physiology or something of that nature that I had not satisfied. So which means that I had to satisfy that prerequisite before I could enroll that fall. So because I was working for an academic institution, if I took it either the fall or the spring, they would pay for it. But if I was going to go to school in the fall, then I have to take it in the summer, and that has to come out of my pocket. So aside the many reasons why I did not want to go that year, included, can I save some money so that the school will pay for, I've paid a lot of student loans to the school. Can the school give me something back, right? So I wrote the best deferment letter I know how and submitted it. Was very scared, but I submitted it, and I heard back, and I don't quite remember the words, but basically either you come now or forget it, right? And at that point, there was no decision to make. Like, why would someone give me such an opportunity and I would not take it, right? So,
and that was at the first school you were accepted to, not at Ohio State.
Yes, it wasn't at Ohio State. Right. It was not at Ohio State. And, I have to say my mentor went to Ohio State, right? So I accepted the offer and then enrolled online for a physiology class, painfully paid for it, and did that class during the summer. And then fall came and packed all my bags and went to Ohio for school. But yeah, and in hindsight, I moved to the country in 2007, and I took all my classes, the chemistry, the biology, the physics, all the doctor classes at the beginning because I was bent on doing that, right? And this was around end of 2007. It was 2018 because school started in 2018. So again, in hindsight, right, that would have been 10 years. Like, had I not taken that opportunity, the next year would have been 11 years and my classes would have expired. At that point, I would neither be an ophthalmologist or an optometrist because there was no way I was going to go back to school and do all those prerequisites all over again. I have a lot of dedication and a lot of passion for eyecare, but I don't know if I would have done that. So I am grateful for Dr. Jasmine and Dr. Ulanski for them stepping in when they stepped in. I did not know any better. And it's like I almost always had a plan, right? And it almost always did not go my way. And it was very emotionally draining, very annoying, very upsetting, because you put your heart and a lot of energy in what you want and you reap nothing out of it. So it was very, I had gotten to the point where I would be fine, laughing, having a good time. And someone would ask me one question about school and everything changes. Like, that's how sensitive that topic was for me. So anytime I had to talk about my struggles, I could not do it with a dry face. You know what I mean? So anyway, I am just going from how everything started, meeting Dr. Jasmine. I worked with her for so long. I wrote my first abstract under her mentorship, my first presentation under her mentorship, my first publication under her mentorship. I cannot speak enough about Dr. Jasmine. And then she does all this for me and then getting me to Ohio State, right? So I remember one time, and anytime I would come back home, I would go visit her, right? And sometimes I don't even text her or email her that I'm coming because she's busy in clinic. If I want to see her, I have to see her between patients. Like, hey, hello, hi, let's talk a little bit. You know what I mean? But I'm just grateful for her and very amazed and in awe how everything has happened. You know what I'm trying to say?
Yeah, you told me something. I think it came from your family that there was this sort of phrase that if it doesn't happen my way, it's okay. And you got through all of that, and it wasn't your way, but boy, it ended up being your way, didn't it?
Yeah. And like right now, I'm just very happy. Like, people ask me, so like, how is residency? How is this? How is this? I'm like, I don't remember the last time I had nothing to complain about, right? That's me now. Like, anything I have to complain about is part of what I chose. Do you get what I'm trying to say? And it's just, I am utterly grateful and realizing that, yes, it's not going to happen my way. But again, however it happened was much better than I planned it. You know what I'm trying to say? Uh-huh.
Right. And you say that everything is good. And part of the reason we connected was that I saw on LinkedIn that you graduated in May of 2022, and you were immediately recognized as the American Optometric Student Association's Optometry Student of the Year. Congratulations on that. I'm curious how you ended up becoming eligible for it, because I know that you got a little bored through school and yet you were awarded. How did that come to be?
Yeah, so I have to start from somewhere, which was 2020, okay? So back in 2020, Prevent Blindness, which is the organization headquarters in Chicago and exists in so many different states, put a prompt out there asking students, people in eyecare, to talk about the future outlook of vision and eye health and what are we going to do to address it. And I saw this as it had my interest, right? It's public health and it's eye care. So I took time off and I wrote this essay that I had a blast writing, and then I won that award. So after that award, national presentation of everything that happened within that conference that Prevent Blindness had, at the end of it, I felt a bit empty, right? Like, what is the point of suggesting an idea if it's not going to be implemented, right? And I felt like it was up to me to implement that. So I started looking for resources. I talked to a number of my professors, Dr. Freeze, Dr. Moody, and anybody I talked to just poured into me, right? Like, I feel like, they added gasoline to my fire. Like, I'm already excited about something and I tell somebody and they do not shut it down. They just like encourage it and lead me to resources and things of that nature, right? So I started looking for resources, and any resource I came across was asking me for a 501c status, which is like a nonprofit status. And so that I assumed that so that they could file taxes at the end of the year. So it was really a stumbling block. Everything was asking me for a 501c status. I was like, okay, if that's what you want, you're going to get a 501c status. And so this was during the time where we were getting all our stimulus checks from the government and everything. So that's where my stimulus check went. But I had help in terms of advice, right? So I contacted Dr. Freeze because he's like a private practice person at school. He teaches us a lot of business in relation to optometry. So I needed his insights. And then he connected me with Keith Cairns, right, at the Ohio Optometry Association. And he turns out to be a lawyer. gave me great advice on how to proceed, so that's how it all started. So, I have friends whom, when I get excited, I spill things I'm doing too, right? So it's not like everything I was doing was in secret. There were people who knew what I was doing and what I was excited about because I spent time with them and we talked and things of this nature. So, and sometimes I felt like I was crazy. Like, why are people listening to me? And like, it was just crazy. But that's the beauty of being a dreamer. Like, you dream it, you get excited, you make it happen, kind of thing, And it gets frustrating when you dream it, but you don't know how to make it happen. So anyway,
you had the right resources. The thing is, you found the right resources.
Certainly. So one of my classmates, Jaime Antonio, very involved in school. He's basically everywhere. There's so many times that I go somewhere and someone hears someone from Ohio State and asks me, do you know Jaime Antonio? I'm like, who doesn't know Jaime Antonio? Anyway, Jaime Antonio, one time, out of the blue, asked me, so he's a close friend of mine. We did Fellowship of Christian Optometry together. We went to Jamaica together. I spent a lot of time with Jaime through the struggles of optometry school. You know what I mean? I'm like, Jaime needs to pick me up when I fall down, kind of thing, right? So anyway, he asked me for my resume one time. And I did not think twice of it. I thought he needed a template to do his resume.
He was gonna copy.
No. Again, I didn't think anything of it. I thought he just, and I trust him. Like, you can have my resume. Who cares, right? So I gave my resume to him, and then later I find out that he recruited 2 doctors from school, 2 faculty from school, and then a good friend of ours, Erlene, and then they all wrote recommendation letters. So Jaime, how do you call it? He nominated. Nominated. And then he had all these supporting doctors support him. And again, these are all doctors that everything that I'm doing in the world of public health or all my thoughts, I just Zoom call them and we chat about it. Like, so that was great. And
that's great.
These are the friends that you need in your corner. I had no idea what was going on. Do you get what I'm trying to say? And then later I find out that that's how it happened. Because again, when I started this, I'm not thinking about what fame is going to get me or what award it's going to get me. I'm thinking, this is what I want to do. And this is what makes me happy. And I want to do global health work, but I'm here in America. How can I do it? I suggested something. How can I implement it? You know what I mean? So he was the one who nominated. And then later I found out and I was like, very, very surprised because he had asked me for one of the doctor's number. And again, I did not think twice. This is Dr. Davis. I did not think twice. I thought he was calling her to congratulate her on Black History Month or whatever it was. Not knowing he was trying to get her to write a recommendation letter. He reached out to Dr. Dean Van Asdale, who's the public health person at school. And I had, because of public health, we talk a lot, express interest and things that we could be doing in the profession, things of that nature. And then, he was my advisor for the Health Equity Scholars Program at school, which is also one of the resources that I found to be able to propel the nonprofit forward. So that is how I got nominated for the Student of the Year award, right? I had no idea, but I was very honored and, again, amazed. And it's just I have friends. You know what I mean?
You sound surprised, but you're well deserving.
Surprised, but there are levels of friendship, right? And it's I mean the word friend in a very raw way, the word in itself, friend. You know what I mean? Where they mention your name in places that you are not, and just I don't know how. I don't have words.
It's wonderful. I want to tie your public health expertise to eye care because you've referenced it a couple times now, and I think optometry should be thinking about it more. The intersection of its eye care delivery and public health. You've talked about health literacy. I heard you say that. What does that mean to deliver a public health minded approach in eye care? Maybe it's health literacy. Maybe it's understanding the shortcomings of a variety of segments of our public to eye care. Give us some advice.
Yes. So I think that, public health is broad. And where optometry can play a role can easily get overwhelming. It gets overwhelming for me, right? Because I feel like, when I was in school, we talked a lot about food deserts, which has a lot of relation to diabetes, hypertension, obesity. So public health is trying to address things like food deserts. And that is important to me as a doctor, as an eye care provider, because diabetes has manifestations in the eyes. And so like as eye doctors, even now that I'm a resident, or in the training, we quickly, like if you have a patient who has diabetic retinopathy, we quickly tell them, maintain your blood sugar, do this, see a PCP, and then we stop there. Primary care provider, but we are primary eye care provider. Like you tell them to go see a PCP, they're primary care provider, but you are a primary care provider. So like, do you know what I'm trying to say? We should be doing, I'm not saying that we should be doing the work of the PCP, but we should not just be handing it off, right? And so the food deserts, these are things that have run through my head a number of times, right? We talk about diabetes, and I'm going to use diabetes as the example. And it's like, there are so many we call it social determinants of health, right? That affects people and that dictates health outcomes. In our world, eye health outcomes. And food deserts is one of them. So let's say the person goes to their PCP and the PCP is like, eat this, eat healthy, do this. What about we think about where the person lives? Do they have access to grocery stores that sell the green vegetables and fruits you're telling them to eat, right? The community that they live in, do they have the green space so that this person can exercise? Is it a safe neighborhood, right? And so this is where it could get overwhelming, because where does our role stop, right? Mm-hmm. Because everything, it is very public health heavy, right? So how do we juggle both? So I guess like the advice could be that we should know our community, where we live. Unless somebody is traveling miles and miles away to come see you, they most likely live in your community. So if you know your community and you know the resources available, hence the grocery stores, the gym, the green space, again, the different things that could address the social determinants that, there are some things that are modifiable, there's some things that you can address, and there's some things that you cannot, right? So if you live at a place and you know the community really well, you can easily give this patient those resources. And then them seeing their PCP is a supplement. And hopefully that PCP also knows their community well. And then it's just a lot of resources for these patients so that they are not just left with go and exercise, go and eat healthy, go and do this. Because the managing diabetes is not just about taking the metformin, right? There is a lot of, where they live, the family members they have, who is helping them out, accessing the doctor, measuring the blood pressure. There are so many different things. So just being conscious of the different things that affect someone's health and doing a little bit more than just go to your PCP.
Does it cross a line to ask them about their financial ability to buy good food for their health? I mean, where is that line? You said it gets very broad quickly. Is that an okay thing to talk about?
I think it depends, right? If you have a patient where you can establish, trust with them quickly, then they will be comfortable to tell you these things. But, we also learn how you should not assume that someone cannot afford something. Whether or not they can afford it does not dictate you telling them the resources available to them. Do you get what I'm trying to say? You may not even need to know their financial status. Give it to them, and then they decide the next steps. And then if you give it to them and they cannot afford it, then maybe they will tell you. Do you get what I'm trying to say? So the financial is great, but maybe it's none of our business. You should just tell them the resources available to them.
Fair.
And then if they tell you because you have established a good rapport and trust with them, then that's great. That's beautiful,
That's very good advice. I want to give you the last word. You're at the beginning of your career. I think my audience should be reminded that you're in your residency after having graduated less than a half year ago. What do you hope to see happen in the first decade of your career within optometry?
Yeah, so, I feel like I am public health, global health optometry. And with being in school and seeing how some classmates um, do things or talk about things, I feel like a lot of people, for lack of better words, are very narrow, right? Like our profession is huge. And I feel like, it's small, but it's huge in the sense that what we are dealing with or what we are trying to address has a huge significance. And I feel like a lot of people may realize that in their little circle. And maybe I see it differently because I'm in the public health and the global health world. Again, I went to Ghana and I saw it from a different angle. And I tried to be involved with the International Agency of Prevent Blindness. And I'm always seeing news from here, from the United Nations, trying to use eyecare to address, sustainable developmental goals. Like we cannot achieve eliminating poverty without addressing eyecare in different countries. So again, it could get overwhelming. Like you are in your little space. There's a problem in your little space. How do I address a global problem? But the thing is that it's you addressing the little local things gets a global impact. Do you get what I'm trying to say? So I feel like I'm biased, like a lot of people should do more than just their little circle. Do you get what I mean? Because the how do you call it? The need is very huge. And it gets overwhelming. That's how huge it is. Do you get what I mean? But there are a whole host of people out there with the same agenda. Do you get what I mean? And, I think it was 2020, I got the opportunity to be IAPB's Eye Health Hero, okay? So this Eye Health Hero gave me the opportunity to sit in conversations with eye care providers, people in eye care, not just eye care providers, across different nations. Meetings or workshops were 4 a.m. American time, whether I was in Chicago or Ohio or Indiana. I just had to go to bed early and wake up early to be on these conversations. But to go on a call and see people from all over the world with the same interest and the same ambitions for eye health, it's just like the conversations keep going and going and going. And just like, again, your fire is already ablaze and people keep pouring petrol or gasoline into it. You know what I mean? And it gets really, really exciting. You know what I mean? So just realizing that what we are doing is no small thing. It is huge. And so if in our little circle, you do your due diligence and you do what you have to do, you are contributing to a greater problem because the problem exists here in America. And if it exists in America, it exists everywhere else, right? So just people realizing that it's not just being an eye doctor. There's a huge thing, and there's a whole agenda, to prioritize vision and eye health in so many different countries so that we can combat preventable blindness. You know what I mean? Yeah, hopefully that answers your question.
I can't wait to see what the impact is of your participation in our profession. I'm very excited to see the arc and the information you bring to us as you get even more deeply involved in delivering eye care. I should ask, you talked about being a cook. You're obviously an incredible conversationalist. You talked about in something that we did before this meeting that you love getting together with friends and eating ice cream. What's your favorite flavor?
I like the ones with coconut shavings.
Coconut shavings. Get out on the edge of
coconut ice cream. That's great. Yes.
I love it.
Yes.
Dr. Araba Otoo, thank you for sharing your perspectives with the audience. It's been wonderful to have you on Sandbox Stories. Thanks for being my guest.
Okay. Thank you.
And to the audience, thanks for attending and giving Dr. Otoo your full attention. She's going to do great things in optometry. And until my next Sandbox Story, be great at all